I'm Jordana Cohen. I am a nephrologist and epidemiologist at the University of Pennsylvania. I do a lot of clinical and translational hypertension research, especially related to the pharmacologic management of hypertension, which involves a lot of blood pressure measurement, of course, and in which I care a lot about the accuracy of the blood pressures we're measuring. For full disclosure, I'm co-chair of the American Medical Association's Validated Device Listing Independent Review Committee, along with Dr. Tammy Brady here. I was moderator of the amazing session that occurred earlier today at the HA Hypertension session on cuffless blood pressure devices, in which Dr. Brady gave an outstanding overview of the many intricacies of the device technologies that are currently available. Dr. Brady, can you tell us a bit about yourself and some of what you spoke about today?
Sure. So I'm Tammy Brady. I'm a pediatric nephrologist at Johns Hopkins. And my clinical and research focus really has been initially with pediatric hypertension and now more broadly cardiovascular health promotion across the lifespan. And I've gotten very passionate about blood pressure measurement and blood pressure devices. And as you mentioned, I'm co-chair of the AMA VDL committee, but I'm also co-chair of the Association for the Advancement of Medical Instrumentation Sphygmomanometer Committee, which is the professional society that comes up with standards and actually comes up with the validation protocols that manufacturers need to use to test devices for accuracy. So I'm very passionate about having devices that are accurate, and I'm also excited about the new innovations that are coming out, which made me very excited to respond to the invitation to speak today.
And so can you tell us a bit about sort of the main theme of some of these devices, the overall arching idea of some of what you talked about?
Yeah, I think these cuffless devices are fascinating because they work very differently than what we're used to. I mean, doing the review for this talk, I realized how long the history of blood pressure is and how we really relied on the mercury manometer and the sphygmomanometer with oscillometric measurements for a very long time. And so the thought of using something different, I think, was very new, and many people don't understand how these devices work. And so I think that was one of the really interesting things to me, is to really do a deep dive in how these devices work, using things like pulse arrival time, pulse transit time, and what the pluses and minuses are of those, and then how these feed into pulse wave velocity and how that actually, with algorithms, will ultimately give you a blood pressure measurement. And also knowing about pulse wave analysis as another method. And so I think that was one of the things I really wanted to focus on with my talk, was to really introduce to the audience how these devices work, so that when they are faced with, there are patients coming to them with a device and wanting to know whether or not they should use it, they would at least have an understanding of what some of the opportunities and challenges are with these devices as it currently stands.
And so can you elaborate a little bit on some of the challenges or issues with these devices and what you think device companies may need to overcome with some of the devices based on what we currently know about them?
Yeah, so they rely on multiple inputs for the most part. So the ones that use pulse wave velocity as a way to estimate require at least two inputs. And when I say inputs, I mean sort of having sensors on the body. The ones that require pulse wave analysis for their estimation, maybe only one, but sometimes more than one. And so recognizing what those sensors are, where they're placed on the body, and what some of their limitations may be in sensing these pulse waves as one of the inputs and pieces of data. I think the other thing that people don't fully understand until you really start looking at it is many of these devices require an initial calibration with a cuff device. Meaning that when you're getting ready to start taking your measurements, you have to use a cuff device to get the initial input and put that into your cuffless device to allow each subsequent measurement to be quote-unquote accurate for you. And those calibrations need to occur at different intervals. Some devices every 2 weeks, some devices every month, and some it's really unclear how long you have before that sort of drifts down into less accurate. And then some devices may not require that cuff device initialization, but they require more like the demographic clinical input. So things like your age, sex, height, and weight need to be input into the device. And then they get the waves, they use some machine learning and some algorithms, and then they use these inputs, which may be the cuff device and the demographic clinical info, to estimate your blood pressure. And so lots of different things that are important. Again, these devices are estimating blood pressure based on these various inputs.
That's really helpful. Thank you for that overview. Now, we heard from Dr. Daishi Shimbo, the pro, of some of the positives of these devices, and we heard from Dr. Ian Kronish, the cons, some of the negatives of these devices. Briefly, if you could talk to device companies right now and give them a wish list of things that you wish that they could do to improve upon these devices, or more information they could provide about these devices, what would you wish to get from them right now in order to sort of improve the likelihood of you using any of these devices in the near future?
So I think they're doing a really good job of coming up with devices that consumers want, right? So many of these are wearable, some of them, they're bracelets or they're watches or perhaps even earbuds in the future. So I think they've really mastered that. What I really hope that they do is really test these vigorously in all of the conditions in which a person might use it, right? So if me sitting at rest right after I've done the cuff calibration, that does really mean no good in terms of determining my blood pressure risk with just that cuffless device. But making sure that when I'm going out and about, running my errands, going to work, maybe running late somewhere, and making sure that in all of those conditions, with activity, with different positions of my arm, all of those things still result in an accurate blood pressure measurement. And then the second thing that I wish that manufacturers would do is, instead of relying on the 510K process to get the FDA clearance for their device, that they would really do this vigorous testing to show it's accurate prior to getting that coveted clearance to allow it to be on the market. Because again, I think many people don't recognize that having FDA clearance does not necessarily mean that the device has been tested for accuracy. It means that it's substantially equivalent to another device that could be had tested somewhere even in the 70s. And so just something to be mindful of.
That's extremely important information. And so I know that I've had many patients now come to me already using these devices. Sometimes I've had to specifically ask them if they're using these devices even to know about it. So they're available, they're in use, and people are definitely using them. What advice do you give to providers right now in terms of what to tell their patients who are using these devices? How should we be delivering information to our patients about these devices?
Well, I want to pause for a minute and just mention that your comment during the session was key about making sure when your patient is telling you that they have home blood pressure measurements, asking them how they got them is really key. Asking them what device they use, asking about the cuff, and then even asking them where they put the cuff on. I think are really important things so that you can interpret those blood pressures appropriately. So I think if patients are coming to me with these devices and having measurements and asking me about them, again, I want to know what the device is, and I'm going to go and take a look to see, has it undergone validation testing, or was it just cleared, or maybe it wasn't either of those things, and let them know that this, I think, is really an exciting area, but I'm not sure we know yet whether or not these measurements are accurate and whether or not they associate with outcomes.
That's extremely helpful perspective, and I fully agree with you. So thank you so much for telling us about everything that you just spoke about in the session. I think that it was extremely well attended for great reason, standing room only, because many of us are seeing this unfold as these devices are becoming available and curious what the next steps are. So we really appreciate your insights.
Thank you so much. It was really a great session.